Yes, the pandemic has made much more visible pre-existing inequalities, and then it has deepened those inequalities. So the idea of tackling those inequalities, both as a cause and then as a consequence of the pandemic, I think is fundamental. When we think of them as a cause, first of all, we have just the social determinants of health, which include unemployment, informality in employment, lack of access to adequate health services, and then a very important component, which is the environmental degradation, which is at the root of the pandemics. And that environmental degradation affects the poor and the vulnerable disproportionately. Pandemics are not natural events. They are as anthropogenic as climate change. And because they are related to the abusive ways in which humans treat the rest of the planet. But that environmental degradation affects the poor disproportionately. So any sense of justice has to start with addressing the root causes. Once the pandemic unfolds, the poor are much more exposed. And in every country where those statistics are kept, we see that poor, disenfranchised, marginalized groups have been affected at much higher rates. In the United States, for example, Black populations and Latinx populations have much higher rates of both of cases and of deaths. The mitigation strategies for the pandemic also affect disproportionately the poor, because if you live every day, it's harder for you to stay at home. In many poor countries, you have also the problem that people cannot stay at home. They live day by day, or they don't have access to technology that would allow them to work remotely. Also, poor people are overrepresented in so-called essential workers that are much more exposed. And then when it comes to the aftermath of the pandemic, we're seeing it. The distribution of vaccines around the globe, which is the big solution, is totally inequitable. So this is a problem that cuts across before, during, and after the pandemic, and we got to address it, and it got to be addressed with deliberate policies. So for future pandemics, inequalities have to be built into the planning. We have to make sure that vulnerable populations are particularly protected, that essential workers receive the protective equipment they need to perform the work for the rest of society. And we need to make sure that social protection measures are geared towards the specificity of people who live day by day, who cannot work remotely, and we need to address those structural causes of inequality as an integral part of the planning for the next pandemic. Well, those two are not necessarily opposed. Precision medicine, which I extend to the concept of precision public health, not just me, many other thinkers are talking also about precision public health, comes from the scientific and technological revolution that has allowed us incredible insight into the very small variations that we have among humans, biologically speaking. It's very small. As we know, humans share 99.9 of their genomes. The two most distant humans share that high proportion of their genome. But that tiny variation allows us a much more solid ability to anticipate, to predict, to have a predictive power, and when it comes to analyzing risk factors, to then gear interventions, both preventive and treatment preventions, so that we assure the optimal response. In the case of cancer, it allows us very defined precision, very precise, hence the name, ability both to estimate risks and to tailor treatment. And that, coupled with our ability to analyze large amounts of data, has led also to an expansion of the concept. So we can apply big data analytical techniques to not just the genetic makeup, that those small differences, but also building social, behavioral, and environmental factors, and try to achieve a highly precise way of tailoring interventions to prevent disease in addition to diagnose and treat it. Now, this in a health system that promotes equity, these technologies should be made available to everyone. The risk we have, as with all technologies, is that they would deepen social inequalities and that you would have that kind of divide. So precision medicine and precision public health are in themselves, have a huge potential to improve our ability and the efficacy of our interventions. As I say, not just therapeutic, but also diagnostic and preventive. But we gotta have explicit deliberate policies to assure that everyone has access to that level of precision that's required. And I actually believe that poor countries can leapfrog, and the promise of genomic medicine and genomic public health, based on both advances in genomics and also advances in computational and data science, have a huge potential if we have a deliberate equity policy, so that poor populations can actually leapfrog as they go through an epidemiologic transition that increases their risks, their exposures to risk factors that account for chronic diseases like cancer. One of the great privileges of my life was to have had Avedis Donabedian as my mentor at the University of Michigan when I did my PhD. And he was one of the deepest thinkers, and I'm very grateful to El Pensiero Científico, because you have played a great role in disseminating his work in Italian and throughout in many other parts of the world, many parts of the world. But Avedis, in addition to a physician and a very rigorous scholar, was also a very deep thinker. He was the embodiment of what we think of as a scholar. And after decades of thinking deeply about quality of care, he concluded that quality is essentially an act of love. And I think what he meant by that is that in his framework, in addition to the famous paradigm of structure, process, and outcome, he also understood that quality has both a technical dimension and an interpersonal dimension, and that you cannot have a comprehensive concept of quality if either of those two dimensions is lacking. And in the end, both of them, the devotion to apply the highest technical standards and at the same time develop all the elements that provide that interpersonal dimension. It's of course the amenities of care, it's the convenience, it's the respect for people's time, but it's also the idea of treating every human being with the dignity that's inherent to every human being. That requires on the part of health professionals an act of love. It is why we call ourselves health professionals. It's a profession of love. And he concluded, again, after decades of voluminous writings and very, very insightful reflection, that quality is love. And I think it's as deep a reflection as possible. And this applies to every dimension of medicine, nursing, public health, of any of the health professions. It is because that's why we are professions. It is a profession of love.